Now, I know some of you will have in your teams people who are very, very familiar, indeed possibly even experts at research and at managing and considering and looking at big data sets. In fact, sometimes even in audits, we try and get ourselves into p-values and significant changes here, there, and everywhere. This is not the type of statistics or statistical analyses that we're going to be using in improvement. In improvement, instead of using enumerative statistics, we're using analytical statistics. Now, there are some differences there, and I'm just going to very briefly explain a couple of them. But I think you will find within the booklet that I've sent to you, there are some really good examples, including graphical examples that you can use to discuss with colleagues who are perhaps a little bit skeptical that the data collecting that you're doing is useful. Yes, it is useful when you're looking at a complex system over time and you're looking to see whether the interventions you're making are shifting the performance of that system. On the basis that every patient is different, every day is different, every clinician and clinician-patient interaction is going to be slightly different, however consistent you try and make them. There will be some nuance that's specific to that moment. And we don't want to lose that because we don't want to be robots, and certainly the patients don't want to be managed as if we were both robots, both them and us. We're human beings and we need to interact. So in analytical statistical terms, we accept that there is going to be some variation. But what we're trying to do is minimize it as much as we can. And we're also trying to make sure that the variation is only there if the patient needs it. It's not there because we've overlooked to do something. We weren't aware that this was a procedure that needed, or that the data set, blood tests, for example, were missing and therefore we couldn't use them in the management of that conversation about carb counting or HbA1c, etc. The variation that we see in the system is entirely determined by the needs of the patient, not by the chaos that we're working in. The second thing about analytical data is that we're looking for trends and we're looking for shifts, rather than looking for an absolute difference between a whole batch of data before we did something and a whole batch of data after we did something. Now, the principle there is that we sometimes can't just do a change. We have to work out what the best change is. We have to refine and possibly even redesign that change over a period of days or weeks. And to be honest with you, as people, we have to learn how to do it well. Doing something brand new, using a bit of a different script when you're a psychologist talking to a patient, or a physician talking to a patient, now that you've worked with the nurses and the psychologists about giving a common message and giving it in this way. These things take time. It always feels a bit clunky and difficult to do it to start with. But practice improves us as clinicians and improves the way in which we communicate with patients. So having a batch of data before we make the change and a batch of data after we make the change is invariably misleading and unhelpful. We need to know as we're making the change that things are shifting and that perhaps something is taking us longer to do, but that actually the outcome of it is improved. And then we get better at doing it. And so both the outcome and the speed of doing it shift. And then the outcome really is a transformed and resilient and robust measure of the success of our intervention. Sometimes, whether it's a clinical audit, a big one or a medium-sized one, we lose some of that richness of understanding, and not least the richness of understanding ourselves as people in the system trying to do the work differently. So use those pages to talk with your colleagues if they're skeptical about how this way of collecting data isn't as perhaps as familiar to them as the normal research databases that we use, p-values and so on. And keep up the great work.